Hello, everyone. I'm Dr. Chris, and today I want to go a little deeper, expand your knowledge of what chiropractic actually is about. We're going to talk today about the spinal nerve chart here behind me. So most people go to the chiropractor, they go because they have pain in their back, right? Some sort of pain in the area, and they think, oh, I'm going to go to the chiropractor, I'm going to get cracked, and I'm going to feel better. And I really want to let you know that that's not what chiropractors are about. The real purpose of chiropractic is to clear stress on the nervous system. So let me give you little details. Right? So literally every person I've ever spoken to in my practice, and I ask them, I say, what controls everything going on in the body? And every single person says the brain. Okay? So that works this way. The brain sends a signal through the spine, and at 32 different levels down the spine, there are nerves that go out to different sections of the body. For example, here, this first vertebra, number C1 it's called, or cervical 1, that controls blood supply to the head. Symptoms can be headaches. A little lower here, about the fourth vertebra, it's called gallbladder. Number 6 in the thoracic goes to the stomach. Lower down here in the lumbar goes into the circulation, into the legs. And so all of these nerves, they all have a function. They're controlling all parts of the body. So that we consider that there's two parts of the nervous system. There's what's called the central nervous system, and then what's called the peripheral nervous system. So the central nervous system is this really nice, contained. It's in the skull, it's in the spine, and all of those nerves are very safe. But they have to get outside the spine and send their signals to the body. And so right at that point where they cross the spine, there's a pinch point. And that pinch point can occur, pinches can occur because of all kinds of issues, from childhood falls to car accidents, to sports, to bad posture, to weak muscles even. So that pinch point then puts pressure on the nerve, and the signal traveling through the nerve is diminished. It's kind of like a hose that's being kinked. The signal going through the hose or through the wire is being reduced. So now this signal is going to let's say this middle one, this T6, that goes into the stomach. So now the signal that tells the stomach what to do, when to do it, coordinating all the functions is now being reduced. So that can lead to a functional problem. So if someone goes into a doctor of chiropractic for pain, what they're really saying is that I have a nerve that's being compressed and my body is not functioning properly. So I love when people come in and go, I'm not functioning properly. My stomach is off. I have a headache. I didn't sleep well. And they come to the chiropractor because they say, I want to be adjusted so that I'm coordinated. So my whole body is performing in this really beautiful function. That's what I'd like to hear. Most people come in and say, my back hurts. And that's okay, guys. The point I'm trying to make is that only 10% of the nerve coming through that opening in the spine, only 10% of that is pain. The other 90% is some sort of function. So if you have pain in an area, that's a 10% of the issue. 90% chance you also have some sort of malfunction. Now, it doesn't mean immediately your stomach just stops functioning and you have indigestion, you can't, acid reflux, you can't digest food. What it means is that organ is not getting the signal as vigorously, as vibrantly as possible, and so it begins to diminish. I mean, imagine if you were in your house and some of the power went out, or the power went out in one room. You wouldn't go out and buy all new appliances. What you would do is check the fuses. So in a body, when the parts are not functioning properly, what we tend to do in healthcare is that doctors will give some sort of treatment for the symptoms. So if a person's having indigestion, they go, here's your indigestion pill. And they forget about that connection of the brain. And so the brain and the nerve is sending the signal to tell the stomach what to do. So if the stomach isn't producing the right amount of acid, it's logical to say, let's check the fuse first. Let's make sure there's a full nerve supply getting into that organ so that organ can do its job. I mean, honestly, you wouldn't go out and buy all new appliances just because the power went out. You would check the fuse and make sure the power was flowing. So it's kind of funny, we often say, well, after your adjustment, we say, okay, now your power is on. It's a little goofy thing, but the concept is that now that your brain and your body are in full connection, the signals are traveling from one part of the system to another, and your body is doing its job. So my goal for all my patients is to make sure that their system is clear. So we're not checking for pain or trying to adjust to remove pain, or we also don't treat stomachs and headaches and back pain and indigestion. We don't treat those either. What we do manage is we manage the communication between your brain and your body. And if we get that connection proper and balanced, then you're in harmony and you can function the way you're supposed to. So if you'd like to actually see a close-up of this chart, go to the website. It's drstorty.com. And on there is a section where you can download this whole chart. You can see each level. You can see each region that controlled by that level. And then you can also see what symptoms are there. And I guarantee you, everyone says, oh yeah, I have this, 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 and this. So that would be a reason to come get checked by a chiropractor to make sure that everything is in balance and harmony, and so that you can function at your highest and best. All right. Well, that's the spinal nerve chart, everybody, and I hope you have a good day, and I will see you next time.